All right, well, we'll get started. Welcome, everybody. Welcome to our regenerative treatments. All right, today we're going to have an introduction. We're going to meet the Revive team, a little bit about us, our collagen treatments, fat restoration treatments, and we'll have some time for some Q&A, as well as you can ask questions in the chat. We'll try to get to them as we go through. All of our social media accounts, as well as some special offers. And a lucky attendee will win a free 2 vials of free Sculptra. The winner will be announced on our social media as well as privately and through an email. So look forward to that. All right, perfect. This beautiful young lady next to me is Miss Susan Brenner. She's our VP of Clinical Operations, and I'll let you go ahead and introduce yourself.
Thank you, Julie. I am so happy to be here with you today and all of you talk about our regenerative treatments. Super excited to talk about these. This has been the trend in our industry to maintain a more natural appearance, and Revive has many options. So very happy to be here with you today.
And hi, everybody. I'm Julie Norton. I'm one of our VPs here at Revive. I've been in the aesthetic industry for over 12 years now. I started as a licensed cosmetologist, cutting hair, doing hair, and then got a position in the aesthetic industry. I love it. I definitely would say I'm an aesthetic expert. I've done anything and everything as far as treatments that we offer, and then more. I have something I like to say to patients when they always ask me where to start, what to do, is kind of, dabble in everything. You want to look like you can't necessarily pinpoint what you're doing, but you want to kind of do everything. So try it all. And here at Revive Med Spa, we've actually been here since 2006, and we are the #1 providers in Botox, Juvederm, Voluma, you name it, Skin Medica, Cool Sculpting, and #1 in California for Morpheus 8. We have 11 convenient locations. The one that you see here pictured is our East Lake location. It's beautiful, featured in Forbes magazine.
Gorgeous.
And we have 5 here in San Diego. We have 1 in Laguna Niguel. We have 2 in LA, as well as 3 in Northern California. And this is our medical team. So Dr. Vishal Verma has been here since the beginning, since 2006. And last year, we brought on Dr. Leif Rogers, as well as Megan Naud, and we are led by the leaders in the aesthetic industry. What are regenerative treatments? I'm going to let Susan go ahead and take it away.
Okay, so as I just touched on, this is the big trend in the aesthetic industry. This has been coming from Europe. We have been using these treatments, some of them, for as long as Revive's been in existence. Sculptra has been around since 1999, and then we've added some additional treatments, dilute and hyperdilute Radiesse, as well as Renuva. So regenerative treatments harness your own body's resources to repair damaged tissue and improve skin quality. Also, you get some volume replacement with some of these treatments as well.
Wonderful. And I'm sure everybody's wanting to know if they're a candidate and what treatments would be best for them. So Susan, what would be a good candidate?
Well, most individuals over 21, as long as you're not pregnant or breastfeeding, if you have certain health conditions, you can review that with your medical provider. But this is a great treatment for maintaining. I mean, we lose the root cause of aging is collagen loss. And that creates wrinkles, and it creates volume depletion. So if you're in your early 30s, for instance, you might want to just maintain with regenerative treatments. As you age and your wrinkles become deeper, you want to regenerate that tissue and return it back to a prior state.
All right, Sculptra, like Susan said, it's been around since 1999, and I myself have done some Sculptra. I love it, love that Sculptra glow. But can you go a little bit more and tell us a little bit more about Sculptra?
Yeah, absolutely. So a Sculptra essentially grows your own collagen. And as I mentioned, the root cause of tissue aging is the reduction of collagen. We lose 1% of collagen per year starting at the age of 20. So this is a great way to restore that collagen. I know we'll get into another slide talking about the mechanism of action, but it is polylactic acid, which was discovered in dissolvable sutures. And it was found that one of the side effects is that it grew your own body's collagen. So it is primarily type 1 collagen, which helps with the structure of your tissue. And Sculptra is very long lasting. The studies that were conducted for FDA approval showed that it lasts up to 2 years. We see it lasting quite a bit longer than that. But we could only say 2 years because the study was conducted for that period of time. Mm-hmm. Very natural looking, helps with tissue quality improvement. This is a great treatment.
And I know we saw Sculptra as more for helping with like a lot of volume. So would you say that Sculptra is, would we choose it over a filler? Is it in conjunction with the filler?
That's a really good question. And the volume that it creates is very slow and over time. Whereas filler is immediate. And a lot of times we incorporate both of these treatments depending on the goals that we are trying to achieve. For example, if we're trying to create contour, let's say contouring a jawline or a chin, we would typically select a dermal filler. But for overall skin quality, a regenerative treatment, we combine these. They're synergistic. We combine these all the time for optimal results.
All right. Wow. So Sculptra, we can also use it in the face, like you said, but we can use it in the buttock area. And these are some great before and after. Can you tell us a little bit about this patient?
Absolutely. This was actually my patient who, of course, consented to have her booty out there. And it's hard to capture these because this is 6 months apart. And the photos taken in the same room, and she wore black each time. So that was great. Mm-hmm. But you could see the power of Sculptra. Look at the fullness. I mean, 2 to 3 treatments are recommended. It really depends on your goals. She ended up getting another 2 treatments because she really wanted more fullness. She wanted that hip dip. Looking rounder, and just really happy with the treatment. So for this treatment, we inject 10 vials at one time, and then the next treatment, 6 to 8 weeks later, or later than that, if she's satisfied with the results after that one treatment.
Mm-hmm. And I know right now with a lot of people losing lots of weight, we're noticing a lot of volume loss in the face as well as the butt area. So this pairing with, GLP-1s, this would be another good, option for volume.
Absolutely. And how an individual responds it's individual. It depends on your age and how much what your anatomy is like, how much hollowing, and your nutrition and sun exposure. All these things play into your responsiveness. Oh, another before and after of one of my patients. And you could see, look at her tissue quality improvement and the fullness in her cheeks. She was really a good candidate for this. We did this slow over a number of years, one vial at a time, and just really great results. I mean, she looks, it really took years off of her.
Yeah. And very, very natural still. She just looks refreshed.
Yeah.
Mm-hmm. All right, our next one. So Radiesse, I know there's different ways to use it, but Susan, you'll go over what we do here and what's different in Radiesse.
Yes, so there are some overlapping qualities between Sculptra and Radiesse. They are both biostimulators. They both stimulate your own body's collagen. Radiesse stimulates collagen types 1 and 3. I talked about 1 helping with the structure of the tissue, and 3 helps improve elasticity. It also stimulates elastin. It's not quite as long lasting as Sculptra, but it some different qualities. That elastin helps with the elasticity of tissue, that bounce back and a more hydrated appearance. Yes, and so the mechanism of action here. So Radiesse is calcium hydroxyl apatite. It is in a gel carrier. So think of it like a peanut M&M, and the peanut is the calcium hydroxyl apatite, whereas the chocolate is the gel carrier, which is carboxymethylcellulose. So it's that gel carrier that gives you some immediate, like subtle improvement. And then that breaks down, and the main ingredient, the calcium hydroxyl apatite, causes the fibroblast to migrate there and then to create that collagen and elastin. So I've had my neck injected a couple times, and I noticed it's just like just cleans it up and just makes me it look more refreshed and kind of cleaned up.
Mm-hmm.
That's how
Same. I did my neck too. Same thing. I did neck and I did above my knees, and for me it was really life-changing being able to feel comfortable wearing shorts again. That was like huge.
Right. Yep. I didn't mention that. So we treat the face and hands, the neck and chest, also arms and knee, above the knees, the thighs, as well as the buttocks.
Mm-hmm. And so these are some really good before and after photos. I mean, I notice obviously right there in the jaw, the lower face is always, I think, like one of the first places you start to notice the sunkenness, especially if you have weight loss too. And so it's huge.
Yep. The submental area. So when the neck was injected, that's one of the areas we inject is right under the mandible there, and to help snatch that jawline.
Mm-hmm. And one of the questions had come through too of just how many times should I get Radiesse injected? How often should you get injected?
Yeah, so the recommendation is 2 to 3 treatments, about 6 to 8 weeks apart. It actually, some more recent studies came out. We can do this 4 weeks apart because we often pair Radiesse and a skin booster, which is a PRP alternative. And that skin booster has a concentrated amount of growth factors and proteins to help boost the results of Radiesse. And we pair this, we have a package where we pair this Radiesse and skin booster treatment with Morpheus to give optimal results. And we pair that where the treatment is done all in one treatment time. And so that is typically 4 to 6 weeks apart, but 2 to 3 treatments are recommended.
Amazing. And this is another great before and after.
And then maintenance, of course.
Yeah. Everything's amazing.
Because we continue, sadly, we continue to age. So yeah.
Yeah. And downtime.
But that's okay. We've got all these treatments available.
Exactly. I mean, nothing's a one and done. Everything's always a continued thing, and how well you take care of yourself in the in-between and the services that you do in between. And then, yes, as far as downtime, of course, any injectable is going to be potentially some downtimes. Yes, bruising like that
is
soreness.
The most common. Yeah.
I
had my arms done too, and a little sore for a few days, and I had some bruising there as well, but it wasn't bad.
Yeah, same. I would say neck was really easy. Knees were a little bit more sensitive for sure, and one leg was a little more sensitive than the other leg. Our bodies are everyone's very different, so one person's experience might be a little bit different than the next. Another great before and after photo. I mean, the arms, like Susan just said, she had done hers. I've seen it done before too. I mean, incredible. That's a huge, huge night and day difference.
Those aren't my arms though.
No. Okay. Oh, okay, perfect. And then we're ending on last but not least, Renuva. So this one's a newer one, but Susan, please take it away.
Oh, this is really amazing technology. Many practices don't carry Renuva. You have to be an elite injector. You have to be certified. So there's training that is required. It is an adipose-derived matrix when it's injected, it recruits stem cells and is replaced by your own body's fat cells. It's like fat grafting in a syringe. This is really amazing technology. I mean, I love all these regenerative treatments, but this one we can use to replace volume loss, or we can dilute it down just as a wash. Let's say if we're just injecting in the neck or the décolletage, we dilute it down, but you get all the benefits of the tissue regeneration. And it actually creates angiogenesis, which is new blood vessel growth. And you will see the improvement of tissue tone, the color improvement, because it's just, you've got new growth. And so this is just amazing technology.
Mm-hmm. All right,
so this is, so as I mentioned, as it breaks down, it recruits your own body's fat cells and is replaced by your own body's fat cells. It will last as long as fat cells live. Fat cells live typically 7 to 10 years. And it's got all these great ingredients of proteins and growth factors and to regenerate your tissue and return it back to a prior state.
Yeah, that's incredible. This before and after, right? She really looks just lifted and fuller and refreshed, taking years off.
Absolutely. Yep. Wow. There's a question there about the difference in downtime. Not really. No, it's just bruising and swelling is yeah, that's the downtime.
Mm-hmm. Soreness, maybe, right? A little bit.
Yeah, a little
tenderness.
Yeah. Mm-hmm.
Mm-hmm. But beautiful.
Oh, how is Renuva different than Sculptra? Well, Sculptra stimulates collagen, and it creates volume very slowly over time. You're going to get more volume with Renuva. And of course, it depends on how much is injected. But I often blend Renuva and Sculptra because the Sculptra actually potentiates the Renuva to give you better results. So if you have really hollow temples, for instance, it is a great option to combine those two. So they work synergistically.
Wow. Love that. And again, I know Renuva is a little bit more scarce, right? Like you said, there's just not a lot of places that are doing it.
Right. It's from donated tissue, and it's an adipose-derived matrix. And you have to have that education. Our medical director in Los Angeles, Dr. Leif Rogers, who was we showed his picture in the beginning, he is one of the trainers for Renuva. And because of that, we were able to get that training. And so there are a number of master level injectors here at Revive who do these treatments.
This is another great before and after. Look at that hand. That's, again, night and day, life-changing for a lot of people.
Yeah, another difference, Tracy had asked about the difference, Renuva and Sculptra. Renuva actually creates angiogenesis, which is new blood vessel growth. So you're not going to see that with Sculptra. I mean, there are other great benefits with Sculptra. It's the collagen stimulator, but they vary in that way. And plus, we can really inject Renuva anywhere where fat lives naturally. I've had it injected in my temples, my earlobes, my hands.
Earlobes.
Yeah, okay. My earlobes, because the earrings, how they start, pulling down, and so it just helps provide that support.
Yeah. Another big thing between Renuva and Sculptra too is this length of time that they last, right?
Right. Yeah. Right. Good point. Mm-hmm.
Okay, wonderful. Love this before and after. Okay, so I know we answered a few questions in the chat. Is there any more questions that anybody has?
And there's still more time for Q&As. I'm going to get ready for the demonstration because we have a model here. I will be injecting. And if more questions come in, I can hopefully answer those while I'm injecting.
Yeah, absolutely. I'll be here. All right. Which treatment is best for cheek wrinkles?
They're all appropriate.
Yeah, they're all appropriate. Just that's something you'd speak with your provider and get, an assessment and consultation for. Let's see here. Yeah, does it work in the cheek area? It just depends on kind of what your needs are and speaking to your provider and taking a look. Perfect. So if you don't already follow us on all of our social media platforms, here's all of our information. These are all also saved in our Instagram. So if you go to our virtual events, you can click on them and see any of our previous events, TikTok, Yelp, and our YouTube.
Okay, hi there. I'm here with Brandy. She is our lovely model. Brandy is in her mid to later 30s. She's never had any type of filler or regenerative treatment ever. And her goal really is maintenance and to help with tissue quality improvement. So what I've done is I blended Radiesse with our skin booster. So she gets these additional growth factors and proteins to help regenerate tissue. So I've already reviewed Brandy's health history. She's a great candidate for this treatment. We've cleaned her face, I'll clean again, and then I'm just going to demonstrate so you could see really how easy it is to get through this treatment. If you put your head all the way back for me. Okay, perfect. So what I'm going to do is just fan through her cheek area, preauricular, and this is just going to help with her tissue quality and give her a little glow. This way and chin up.
And so another question's come in is, would this help for under eyes for dark circles?
We can use the this way a little bit more, dear. Sorry, I'm trying to multitask here with the skin booster under eyes.
The skin booster under eyes.
Yep.
Mm-hmm. And so the skin
3 treatments are recommended for that.
Yeah. Everything's really in a series, right? Nothing's a one and done. I think that's really important for a lot of people to know, is trying something like this it's not going to do the benefit or give you the full outcome. And
okay there,
Susan is actually doing the skin booster with the Radiesse now. So, and this is something she touched on previously, and how we're pairing it with our Morpheus 8. And so you would get something like this injected first.
Just like that.
And then
so we're finished with the one side.
Easy,
you see just a little bit of swelling. It's not crazy. It doesn't look like she's going to bruise, just a little bit of bleeding, which is typical, right? We're puncturing the skin. She could get bruising, but it doesn't look like. I don't think so. And Brandy, how did that feel?
It wasn't too bad at all.
Yeah, there's a little lidocaine in here, a little pinchy. Let's see. Gorgeous. What's that?
You can do this side of the
yeah. Okay, let's do it.
Yeah, how often do you recommend doing Sculptra? Once a year or every 2 years?
It really depends on how much is needed. Yeah, so it depends on your anatomy. And so most individuals should commit to a package of 4 vials. We often inject 2 vials per treatment. And again, it depends on where you need it. So if you have temple hollowing, then I would dedicate 1 vial between the temples. And then if you have hollowing in your face, and that's typically in the preauricular area, Then, and also if you want just a little more fullness in the cheek, we would split a vial there and then have you come back 6 to 8 weeks and do another round. And then maybe wait about 6 months to see the full results. You also, I forgot to mention this, the Sculptra glow. People love that Sculptra glow, and I hear about this all the time. And usually within a couple of months after treatment, you'll notice your skin is just more glowy, and that's from that collagen stimulation.
And for aftercare on Brandy's treatment for the Radiance Skin Booster, what would that aftercare look like? And would she need a massage?
No, she doesn't need to massage at all, not for Radiesse. Let's see, change my gloves here. Just like no sweaty workout, no sauna, jacuzzi, 48 hours. Just be sensible about that.
Very clean.
Keep it clean. Yeah, don't put makeup on right away.
About how long? How many days before putting on makeup?
And just the next day is fine.
And would any of the regenerative treatments require any kind of massaging?
Sculptra does. Yeah, so Sculptra, you massage. Well, the study says 5 minutes, 5 times a day for 5 days. What is really common in aesthetics is that it's fine to massage twice a day for 2 minutes for 2 weeks.
Okay. So, well, Carolina has stuff with massaging. Okay.
Yeah.
Okay.
Okay, let me see this now. All right. And we'll go to the other side. Another thing I wanted to mention, since we're talking about regenerative treatments, we also have a regenerative topical. So plated intense serum is a topical for your face. They're actually also coming out with a topical for the under eyes. A sample was brought by to me today. I actually put it on because my bags were pretty bad this morning. And the formula helps just reduce inflammation, but plated is derived of platelet-derived exosomes, and exosomes communicate with other cells in the body to regenerate tissue. So this is a great pairing with the treatment that you're getting. You're looking for a topical, that's the next one I recommend. I use that one daily.
And as far as a lot of patients are concerned with pricing and kind of figuring out what's the best treatment options for them. Always recommending that they come in and speak to a provider, of course, to figure out which treatment plan. But we do have a question considering is price difference between Sculptra, Radiesse, and then Renuva, of course.
Julie, do you have pricing information on that?
Well, we have a couple different promotions that are going on right now, so I always recommend that patients come in and do a consultation.
Absolutely.
Yeah.
Now, Renuva is a little more expensive. And that's because, it's from donated tissue. It lasts a whole lot longer, a whole different technology. So Renuva is, I believe it's about $21.50 if you are a member per 3cc syringe.
And we offer monthly payment options for everybody as well. So just depending on.
You survived it.
Wasn't bad at all. Done?
She's all done. So we'll schedule
Super fast.
her next appointment about 6 weeks or so.
And if she was doing a Morpheus right after this, then
Yeah.
we could do 4 weeks.
What we would do exactly. So 4 to 8 weeks is really ideal. And if we're doing Morpheus following this treatment, we would just put the numbing cream on at this point, and she would numb for about an hour and then do the treatment. And that's another trend right now is these multimodalities and stacking treatments and to get optimal results and kind of like bang it out. Yep.
Couple other questions. Can Sculptra, Radiesse used one after the other, maybe 6 months apart, or can you commit to one of them?
Oh, you can, yeah. A lot of times I'll alternate because they work synergistically and they have some overlapping qualities. So I love doing that. And then adding that skin booster also. I mean, that's another option that we have here to boost results.
Oh, and as far as like for the image, Melanie's asking for the image of the Radiesse on the hands, how many vials of Radiesse did that take? Or
that was after one treatment.
Yeah. And I guess how many is it, syringes or vials?
It's by the syringe,
By the
and one
syringe.
syringe at a time.
Okay.
Just split one syringe. Okay.
Wonderful.
Yeah.
Thank you, Brandy. Thank you,
Thank
Susan.
you, Brandy. You did just great.
Thank you.
Yeah.